So I started this company about 4.5 years ago, and the first $100,000 was from a couple of angel investors who had been working with for about 6 months to get them excited about what we're doing here at Catalia Health. So Catalia Health is a chronic disease care management company. So you can see in the background we've got robots all over the place. So we do build a bit of technology, a lot of artificial intelligence, but at core we build programs to help patients who are dealing with chronic diseases to stay on therapy and out of the hospital. So I've been working in healthcare technology for over 2 decades now. One of the things I've seen along the way is, medicine has changed greatly over the last, 50 or 100 years, right? Depending on what time scale we want to look at. Pharmaceuticals, devices, basic understanding of the body and medicine, and we've done a lot. The proof of that is we live a lot longer, right? Compared to 100 years ago, life has been extended by about 30 years on average, which is incredible. But one of the challenges that comes along with that is we're dealing with more and more chronic conditions. And most of dealing with that is what happens not in a clinical setting, not in the hospital or the doctor's office. It's, here you've got this, here's your treatment, go deal with it. Come back and see me in a month or 6 months, or call if something's wrong. And that part of medicine, how we deal with that, really hasn't changed in a very long time, if really ever. And so there's a lot of issues that need to be solved there to really improve healthcare. So that's what I've been doing for a long time. And that's what we focus on here at Catalia Health. How do we do that in a way that's really scalable, that we can help a lot more patients a lot more frequently than is possible otherwise? So when we're thinking about some of the challenges with chronic care, these are things that are not something we deal with for a few days or a few weeks or even a few months. These are years or decades for most people. And over the course of that time, we need to better understand the disease itself, how we're dealing with it, what the medications are, other things that we're doing, and how do we really stick with it? When you're thinking about things that happen in our everyday lives, our health is important. But actually dealing with it day to day, sometimes that's important, sometimes that's a little challenging to stick with. And those are the kinds of things that we focus on. How do we help patients? How do we help people who are dealing with, as part of everything else going on in their lives, do a better job of doing all of that? So when I started working in healthcare technology, this was over 20 years ago. And at that time I was doing an undergraduate degree in computer science and artificial intelligence, thinking about going to med school, and actually decided not to go to med school, that instead of helping one patient at a time, that by building technology that would be scalable, it was a way to have an impact on a lot more people. And that's been my focus ever since, and that's why we started Catalia Health, to really try to take some of the things that we found over the last 15 to 20 years and make them accessible to a lot of people. So healthcare technology as a concept is not new, but in terms of actually commercializing it and rolling it out, it is still fairly new. We've had stuff for decades now in terms of technology in healthcare. We can think about a lot of pharmaceuticals or devices, and those are parts of the healthcare industry that are common and accepted now. But when we think about a lot of digital inputs or devices or other ways of using modern technology in healthcare, that's still fairly new. And actually getting this out into the market, healthcare is a huge industry, which means that there are a lot of players in that industry that have a certain way of doing things, sometimes for good reason. We figure out what works in medicine and we want to stick with that, but sometimes for more challenging reasons, right? Just a slowness to change. And a lot of the challenges that I see in this space and that we experience at Catalia Health have to do with making changes in what is an enormous industry. What I love doing is creating things that can have a real impact. And to me, healthcare has always been an area of interest. And bringing together a couple of very exciting areas, healthcare and cutting-edge technology, is extremely exciting. Right? Being able to do things that no one else has done that can have a real impact in the lives of people is what drives me. what's next for Catalia Health is scaling this to a lot more patients. And we're doing this across a number of different disease states. We've got a lot more to do around there. For me, it's somewhat the same kind of thing, right? Trying to understand where we can have a bigger impact, both at Catalia Health and in related things around the healthcare industry. The healthcare industry right now is changing in a lot of great ways, using technology to scale the kinds of things that we've traditionally done only with people, because we have so much more need than we're able to deliver with people alone, that I think there's enormous opportunity over not only the next few years, but the next few decades to keep doing things like this. So there's a few things that have changed in relation to the kinds of things that I'm doing in terms of venture. One thing that we've seen is there's a lot more diversity of money available at the early stages when you're talking about the kind of pre-seed or seed or pre-A or whatever you want to call each of these rounds. The amount of money I raised in the entire life of my previous company was less than what I raised for our first close of our seed round for this company, right? So that's 10 years ago versus about 4 years ago, but that's an enormous difference. And we're seeing that continue to change right now. And so being able to raise a little bit of money at the earliest stages of a company for a compelling idea, I think is easier than it ever has been. Beyond that and scaling it, I think it's still challenging. The other thing that I'm seeing is just this broad area of healthcare technology has more interest in the last 2 or 3 years than ever before. Vastly different from when I started my first company more than a decade ago. There's just a whole lot more interest and understanding of this space than there ever has been.